Encarnacion, your nurse practitioner for today. So you are?
Charmaine Hernando.
Okay, so Miss Hernando, so today po, magpe-perform po tayo ng head and neck examination. Ang head and neck examination po is isang pagsusuri na kung saan sinusuri po ang inyong head and neck for some signs and symptoms of diseases and complications po. So may mga itatanong pa po ba kayo, ma'am?
Wala na po.
Okay.
After that, perform hand hygiene. Inspect the head and then the face for color, symmetry, lesions, and distribution of facial hair. And then, note facial expression. After that, palpate the skull. Inspect the external eye structures, which includes the eyelids, eyelashes, eyeball, and eyebrows. You must inspect also for the cornea, conjunctiva, and sclera. And then, note the color, edema, symmetry, and alignment. Examine the pupils for equality of size, shape, reaction to light, by darkening the room and using a pen light to shine the light on each pupil. To test for papillary accommodation and convergence, ask the patient to focus on an object as you bring it closer to the nose. Using an ophthalmoscope, check the red reflex. Test the patient's visual acuity with a Snellen chart. Ask the patient to read the smallest possible line of letters, first with both eyes and then with one eye at a time. With the patient about 2 feet away, ask the patient to focus on your finger and move the patient's eyes through the 6 cardinal positions of gaze. Inspect the external ear bilaterally for shape, size, and lesions. And then palpate the ear and mastoid process. You must also perform an otoscopic examination. Note for cerumen or wax, for edema, discharge, or foreign bodies, and condition of the tympanic membrane. For an adult, pull the auricle up and back, while for a child, pull the auricle down and back. Use a whispered voice to test hearing. Stand about 1 to 2 feet away from the patient out of her line of vision, and then ask the patient to cover the ear not being tested. Perform tests on each ear. Use a tuning fork to perform Weber's test and Rena's test if the patient reports diminished hearing in either ear. Inspect and palpate the external nose. And then, palpate and lightly percuss over the frontal and maxillary sinuses. Transilluminate the sinuses if the patient reports tenderness. Occlude one nostril externally with a finger while patient breathes through the other. Repeat for the other side. Inspect the internal nostrils using an otoscope with a nasal speculum attachment. Palpate the temporomandibular joint by placing your index finger over the front of each ear as you ask the patient to open and close the mouth. Inspect the lips, oral mucosa, hard and soft palates, gingiva, teeth, and salivary gland openings by asking the patient to open the mouth wide using a tongue blade and pen light. Inspect the tongue. Ask the patient to stick out the tongue and place a tongue blade at the side of the tongue while patient pushes it to the left and to the right. Inspect the uvula by asking the patient to say "ah" while sticking out the tongue. Palpate the tongue for muscle tone and tenderness. And after that, remove your gloves. Palpate from the forehead to the posterior triangle of the neck for the posterior cervical lymph nodes using the finger pads in a slow, circular motion. Inspect and palpate in front of and behind the ears. Under the chin, and in the anterior triangle for the anterior cervical lymph nodes. Inspect and palpate the left and then the right carotid arteries. Only palpate one carotid artery at a time. Use the bell of the stethoscope to auscultate the arteries. And then, inspect and palpate the trachea. You must also palpate the thyroid gland. If enlarged, auscultate the thyroid gland using the bell of the stethoscope. And then, inspect and palpate the supraclavicular area. Inspect the ability of the patient to move his neck. Ask the patient to touch his chin to chest and to each shoulder, each ear to the corresponding shoulder, and then tip head back as far as possible. After the procedure, perform hand hygiene.